to Justine. And Justine, I see you're there. Remember, folks, she's halfway around the world in Africa, here for your benefit.
Hello. Trying to get the light here. It's like
Mm-hmm.
2 o'clock in the morning, so I'm trying to get some light on this camera there. Okay,
There you
so
go.
at least you should be able to see now.
Yeah,
Yes.
you have a screen to share or not? Either way.
I do, yep. I'm going to share my screen. And here we go.
Awesome.
All right.
So
Okay, so thank you so much, Ron, for that great introduction. And like you said, I am in Africa. There's a little bit of a locust bug problem. So if you hear any loud noises, it's just me swatting them away. So thank you for being patient with that. Anyway, so let's get started. So this is all about my experience reporting on the pandemic in New York City, which has been a crazy experience with so much going on, as you can imagine. I want to show you just a quick clip. We'll see if this plays, just of a couple of the stories I've done just relating to the pandemic. So let's see if this plays here. This is a big day for families all across the city. We're going to be seeing thousands of teachers and 6th, 7th, and 8th grade students coming back inside the classroom for the first time in 2021. This is all part of Bronx Rising's campaign to vaccinate 15,000 seniors in just 8 weeks. Stores are also taking all the necessary precautions to try to keep customers safe. Protests across the country and even in Brooklyn have turned violent, but the organizers here in the Bronx saying they're not going to let that happen. This is going to be a peaceful protest where everyone stays safe. Okay, so I hope you could hear and see that. I hope.
hey.
So that's just a little bit of what we do, going out every day and reporting in the field. I go in and get assigned a story, or I pitch a story, go out, find people to talk to, report on that story, shoot the video, record the on-camera part, edit it, and get it on the air. So we do that every day. And during the pandemic, obviously, things just got a little more challenging. So some of those challenges were reporting on government and official information. Also trying to spread information without spreading panic and making the situation worse, keeping coverage engaging, and then also staying safe while trying to get the story and do a good job reporting, but staying safe in the process. So I'll go to the next one here. So reporting on government and official information is obviously always a challenge, because there are certain things that officials want you to know, certain things they don't, and certain ways they try to manipulate or not that information just to try and get their own view across. But here, the biggest challenge was the discrepancy between the different levels of government and what they were actually telling us. So they had actually different positivity indicators for all of the different data they used to measure levels of COVID-19, whether it was people getting vaccinated, people testing positive. Those levels were measured differently between the state and the city. And so it was such a challenge trying to figure out what actually is the information to then go ahead and report. So when it comes to the positivity indicators, the state used a different metric than the city, and neither one of them was really wrong. Even experts weighed in and said, they're both valid ways, but when they are in conflict, that creates problems. One of those ways is that there was a 3% positivity rate trigger set in place, that if the positivity rate in the general population reached that level, then the schools would close. So if you can imagine having two different levels, that became a problem. For example, it was on one day back in September, 3.25 positivity rate reported by the city, whereas the state was reporting that in the city it was 1.75. So what do you do then if the cutoff rate is 3%? Are schools opening or are they closing? So not only is that hard for us to then interpret that message, but then for us to re-communicate that message, which message is it, to the public, and then also for the public to interpret that message themselves. So do they need childcare for their child the next day? Is their child going to go to school the next day? So just actually getting the message itself, and then seeing how that changed policy and guidelines was a challenge in and of itself. Then another thing that was interesting is that both the governor and the mayor started doing daily press conferences. And in the past, pre-COVID, they had done press conferences maybe a couple times a week, depending on what they, had to discuss. But they actually started doing these daily press conferences, and our station started carrying them live on air. So this now gave a whole new platform, a whole new channel for them to express themselves, because while anyone could go on their YouTube channel and look up a press conference and watch it, most people didn't do that. So now they were seeing this full press conference aired on TV every single day. Obviously, the White House was doing their own briefings as well. But our local channel in New York was airing both of these. And then on top of that, we were covering both of them. So it really gave a new channel to these politicians, which in some ways is good because they got to directly address the public. In some ways, maybe not so good, because a lot of information that's conflicting between them can actually then become more confusing when there isn't someone to try and interpret that to then tell the public. But it just was an interesting change to see them actually have a new channel now. So continuing with that, the conflicting messaging was also hard when it came to, for example, indoor dining. So on the same day that Governor Cuomo shut down indoor dining, he also released data from his own office saying that the vast majority of new corona cases were not from indoor dining. The percentage was so low, it was under 10%. I think it actually was like close to 1% of new cases they had traced from indoor dining. Yet that same day, he shut down indoor dining. So then the restaurants were obviously upset about that. You can see in this picture over here, the restaurant industry was protesting. They actually had a casket they were carrying saying, like, you're killing New York City, you're killing New York City dining. So that was frustrating for them. And again, conflicting for us, because we're trying to say, oh, this is maybe why he shut it down. This is what's happening, when his numbers didn't reflect that. Also with that, local shopping. So on the same day that Governor Cuomo encouraged everyone to shop from home and saying, do online shopping, do anything you can to not leave your house. Eric Adams, who's the president of Brooklyn, so the Brooklyn borough president, came out, and I did a story on him that day saying, come out and shop local. So he said, make sure you wear your mask, obviously make sure you're following precautions, but come out and shop local. He even proposed a bill at the around Thanksgiving time and Black Friday to say there should be no sales tax at local businesses through the end of the year, to encourage that even further. So you're having the governor say, stay home, do everything online. And you're having the Brooklyn borough president say, no, come out. We're even going to try and maybe help you out with taxes to get you out here. So not only is there that conflicting message within the leadership, but then there was also a lot of flip-flopping on that. So you can imagine, as I'm sure in every state, there was so much pressure on every level of government for whether it was funding or reopening or anything at all, that the strongest in New York were definitely the teachers union and also the restaurant industry. So again, the restaurant industry, people were out protesting in front of Governor Cuomo's office several times a month, and oftentimes more than that. The teachers union released a lot of information as well. And you can understand that might be challenging for the leadership, but it really was challenging for the media, because we're sitting there reporting on that, then trying to get the government side of it. Well, are you going to do anything? And they would flip-flop even within a day. So we would go out in the morning to interview someone at a restaurant and say, how is this affecting you? What do you want? What do you hope will happen? What's going on? And then within 2 hours, the policy had changed. So we heard from the mayor, and they said, oh, no longer this or that. So now we got to go back to the restaurant. Okay, so now what do you think based on this new update? Then we'd hear an hour and a half later from the governor, oh, no, that's changing. So the flip-flopping was hard on the people who obviously were teachers or were in the restaurant industry, but also hard on us trying to report that, because the story changed constantly. So that was a challenge there. One of the biggest problems was spreading information versus panic, because already the media is often accused of trying to be sensationalist or trying to make things more exciting or dramatic than they are. And obviously we responsible journalists try not to do that. But during the pandemic, it's so dramatic already that in a way it's almost impossible to not report these situations dramatically because they are dramatic in and of themselves. So first of all, with the chicken versus egg thing I have here, you can see this picture. I took this back in, I think it was April, of the empty store shelves that we all saw for months. And this whole thing with the toilet paper run and how that was a scarcity for so long, probably started with a guy just stocking up on a little bit of toilet paper, reporters going out asking, as we do before any other natural disaster or anything going on, big event like that, hey, stocking up on anything? He said, yeah, I'm stocking up on a little toilet paper. Reporter reports that, people are stocking up maybe on some toilet paper. Then you see people hear that message and they say, oh, I should go out and I should buy toilet paper too. Well, now it's a bigger story. So we go out, look, all the people are stocking up on it. Now the people who didn't stock up yet are saying, oh, well, now everybody's doing it. Now I really got to go do it. So it's kind of hard. Who knows who the first person is who reported on it or bought the toilet paper, but they kind of go hand in hand, because as people do more and more of the stocking up, we cover it more and more, and then it gets to be this point where there's nothing left on the shelves. So one of the ways that I try, and many journalists try to not encourage that, is to try to not say things like should. So for example, saying like, oh, you should run out and get the toilet paper too. And sometimes I do hear reporters saying that, but we all, I think, strive to not say that and just say, hey, these are the facts. This guy's stocking up. There is a shortage here or there, but not trying to put our own judgment on it of, oh, you should or you shouldn't do that, and let people interpret what's actually happening as it is. The same thing with this dealing with dramatic situations. So here is a picture. This is a drone video that someone took over Hart Island, which is a small island off the coast of Manhattan, of this mass burial. So people who were unidentified, who died of COVID, were buried there because there were so many bodies piling up. And it's such a dramatic situation as it is that we all tried to, myself and my colleagues, report on it by just saying the facts. So that's what I have here, more facts and description. This is what we're seeing. This is what's happening. And fewer adjectives of, oh, it's so tragic and horrible. And, let people decide that for themselves. Yes, we can all agree that probably a mass grave is pretty tragic, but trying to keep that impartiality and to not say, well, this is my opinion about it, but to just say this is the fact. But again, it's so hard when these situations are so dramatic in and of themselves. Over here, this photo, these are these refrigeration freezer trucks that were brought in when the morgues filled up. So this was outside of a hospital in Queens. The morgue was completely filled up. There was no place to put the dead bodies. And so they brought in these huge freezer trucks and buses. So again, so dramatic in and of itself that in trying to report on that, it's important to try to stay impartial and not make it even more dramatic than it already is. Another thing is keeping the coverage engaging. So we did so many stories on I can't get a test, and then I can't get a vaccine appointment. And while these things are obviously important and this is what's going on, we're always trying to find new ways to actually keep it engaging. And with a pandemic, especially, that's hard because it's lasted for so long, right? It's been more than a year now and we're still going. So with many other stories, if there's a fire or shooting, you talk about what happened, maybe a little bit of the aftermath, and it's over. Whereas this just continues. So it's always trying to think, how can we make it engaging to people so that it's something new? So for example, I found a story on a woman who started a lasagna nonprofit. So she started this chain where if you wanted to make lasagna and if you needed food, or lasagna in this case, you could come together on this website and actually have some people make lasagna for others and go deliver it in a COVID safe way, and all these precautions included. But just trying to find little stories of ways that certain people were dealing or what certain people were doing, so it's not just the same story on, oh, look how long this line is for a test yet again. Also putting faces to the numbers and talking to real people. So those things obviously go hand in hand, as we know. Trying to say like 1,000 people died or 10,000 people are sick is kind of meaningless to just hear those numbers. So always trying to find people to talk to and share their unique and individual stories to say, this happened to this real person and this is their real story, not just they're another number, another face in the crowd. Another thing that was important, especially since the pandemic lasted for so long, is not forgetting other news. So this happens anytime there's a massive news event anywhere in the country. That's going to kind of prioritize the coverage. But there's so many other things happening. So, for example, this was a story on a missing girl. This one was a story on this crazy bus crash where this bus went over a divider there. But you know, it's so important to tell the stories relating to COVID, but also to tell the stories relating to everything else going on in life that people are dealing with on a daily basis, in addition to the pandemic. This is another picture from Halloween, again, trying to tell people the CDC guidelines with wearing masks and all of that. So again, trying to tell people information that's actually helpful to them, as well as keeping that coverage engaging and trying to cover all the news that's happening, not just the pandemic. Staying safe while getting the story is always a concern, obviously, as a journalist, whatever you're covering, because if you end up not being safe at the end of it, you can't even get the story out. So reporting on protests was a big thing this last year after everything that happened following the George Floyd murder, and so many other events last year. We were covering protests all the time for a while. It was nonstop there. And, you know, our news directors would say, obviously try to maintain social distancing and all of that. But I mean, if you're in the middle of a protest, you're in the middle of a protest. And if you want to cover it from 20 feet away, you're not going to get the same story as actually getting up there and talking to people and filming and getting those images of what's happening right there in the middle of it all. So that was a challenge, and basically came down to each individual reporter and photographer's own comfort levels. And at some points just saying, okay, this is really unsafe now. Everyone is inside packed together without masks, or, okay, this is something that is worth getting the story for, or at least people are social distancing or whatever. So that was a constant kind of back and forth. Reporting on COVID deniers was also a challenge. There was a big group in the Hasidic community in Brooklyn who completely denied COVID and refused to wear masks, and actually were antagonizing some reporters. I was lucky enough that I wasn't in that moment, but one of my colleagues was, I mean, literally like had someone getting right in his face, trying to push the camera, all of this. And it's important for us to get that story because that's where one of the major hotspots was, as you can imagine. And so trying to get that story while also staying safe with people who literally are saying that this pandemic doesn't exist is challenging. You can see, again, this is one picture of me, you know, in the middle of people who are protesting. A lot of them are wearing masks at least. And then here, not that these were COVID deniers, but this Trump rally that I covered, you know, you can see almost no one is wearing a mask. So, and there were people on both sides, sometimes wearing a mask and sometimes not. So it wasn't just down political lines. It's just to show that sometimes people are wearing masks, sometimes they're not. Sometimes you're outside, so you feel more comfortable. Sometimes you're inside, but it's a different story all the time. And the thing that I actually found the hardest was getting close enough to tell the story. So for example, on almost a daily basis, we're going inside somewhere to tell a story. And a lot of the time that's someone's apartment or home. And when you go inside, obviously you can now shoot video of what is their apartment like. If there's a problem there, for example, this is a public housing complex that had no heat for months. So trying to tell that story from outside is like, you know, you're standing in front of a building and what, there's people just standing there talking about it. Whereas when you go inside the building, you can see this woman is under coats and sleeping bags. And another woman had taped plastic around every window to try and keep the draft out. And other people had hot plates. And it was a whole, you know, situation of what was going on there. And if you didn't go inside, you didn't get that story. But this is at the height of a pandemic. So there were certain times when, you know, it was, you kind of had to, again, think for yourself, is this worth getting the story? Can I get the story from staying outside? At really the height of the pandemic, they told us, you know, don't go inside anywhere. And the people scheduling a lot of our stories at our assignment desk would try to say, you know, try to schedule stories so you didn't have to go inside, schedule Zoom interviews so we didn't have to go to someone's office, because again, we want the people we're interviewing to also feel safe. But that was a challenge. Also going into hospitals, testing sites. I mean, they told me to go into a testing site in the biggest hotspot area in the entire city. And I was like, what? I'm not going to go inside there. I'm sorry. It's the people who are working there are wearing full hazmat suits. And I'm not going to go inside there with no protection. So there are definitely times, there were times when I had to say, I'm just not doing that. And I'll get the story from outside. There's a huge line. I'll talk to people outside, socially distanced. But at a certain point, you have to say, is it actually smart to go inside this COVID testing facility in no hazmat gear and, basically just a mask, just to maybe get one extra shot of someone sitting down to get the test? And in that case, I said no. So it really just depended on the situation. Also, when it comes to staying safe, they tried to give us some precautions from our leadership team, which, again, on some of those levels, appreciate that. Some of them were pretty non-helpful, I would say. So for example, they said use a 6-foot interview pole. So they basically took a broomstick. You can see here this stick that holds the microphone, or here's another example. And they say, okay, hold that so that then you're socially distanced while you're interviewing. But if you think about holding a 6-foot, or even longer than 6-foot pole out that far, I mean, you can't. You're physically, like, if you're trying to do a 10-minute interview, I mean, you can't even hold it. And also, this is an example. I was on a bus doing a story by myself, no photographer. I was shooting the whole thing and doing the interview. Like, how am I supposed to be holding a camera and then holding a 6-foot pole on a small bus? I mean, it just wasn't possible. So again, trying to get that story, trying to use these precautions they put in place, it's nice, but it's also not necessarily practical. They even tried to help us with our workspaces in the newsroom, saying for a while no one was allowed in the newsroom. So again, I totally understand why they gave us these news trucks to sit in. You can see this is an editing setup inside one of those news trucks for us to use. So again, that's great that they were trying to take those precautions, but it's interesting what that does to the communication within a newsroom, right? We've all experienced over the last year what it's like to not go into an office. Obviously, if you have a quick question, you want to just go ask someone, you don't have the social aspect, but in a newsroom, it's especially kind of different, because especially when we're dealing with breaking news, it's an all hands on deck. You have the assignment desk, you have the producers, the graphics team, the directors, you're running around. If you're out in the field, you're calling back and talking to all these people. And we had our assignment desk was kind of our central kind of brain, and then they connect everybody, and having people work from home, and then the phone's not connecting, the internet, so again, it's problems that everyone's facing, but it's really hard when it's a breaking news situation and we're used to being able to say, okay, you get this, we have to be on the air in 2 seconds, 5 minutes, let's go, and not having that to be able to kind of deal with the immediacy that's needed there. That's even true with our producers who were producing from home. So there's a lot of software that's amazing. They can talk to us through our IFB, like through the thing that's in our ear to hear directors and producers while we're live. They actually could talk to us and everything from home. So there's a lot of great technology that helped with that, but it was just tough dealing with not having that kind of central newsroom environment to get the story done. And then lastly, just wearing a mask, obviously something that so many of us have done for so long now, but it's hard when you're on camera reporting, because in most situations you want to wear the mask, obviously to stay safe, but then also even if there's no one around outside, you think, well, maybe I should wear it to be the good example of, okay, I'm wearing a mask as a somewhat public figure and doing the right thing. But then we would get direct messages through our social media, myself and a lot of the reporters, from people saying like, oh, you're just causing more problem because look, you're wearing your mask when there's no one around outside. It's not necessary. You're just trying to look good. You're just trying to look like you're doing the right thing. You are, you shouldn't be wearing the mask. You're spreading fear, things like that. And then you'd say, okay, well, if I don't wear the mask, then you get messages of you're being an irresponsible public figure by not wearing it. So it's just another thing where it's like, okay, how do we balance what's the right thing for us to do and what the public is going to think when they see us communicating to them on their TVs. So that is pretty much what I wanted to talk about. Just thinking about what's next, things have come up recently with Governor Cuomo's controversy. There's so many different scandals that I won't go into all of them, but basically he's being accused of a lot of different things. And he recently started not allowing press at a lot of his media engagements where normally press would be involved. So already the governor and the mayor are doing their press conferences daily virtually, but then he would go, for example, Governor Cuomo, to the Javits Center, which is our main convention center and the main place for vaccines in Manhattan. And he just recently, I think it was last week, held a press conference there, but no press was invited. So they had their own press people from the governor's office record him kind of going around and touring the facility and speaking to some healthcare providers, record that and give it to the press so that the press couldn't go in and hound him on any of these controversies that are surrounding him right now. So that's just one more challenge that is continuing now. And then the challenge that always happens with a story that goes on for so long, especially one as important as the pandemic, is just how it keeps changing. So we have, originally it was, can you get tested? Then it was, can you get medical care? Then getting vaccinated. Now things are how they're reopening. They just announced that now if you go to any Mets or Yankees game, you can get the Johnson & Johnson vaccine while you're there. No questions asked, no matter where you're from, and you get a free ticket to the next game. So they're really pushing for that. But it's just interesting seeing what is the most important thing to report on from the beginning all the way through till now. And we'll just see as that keeps changing, what's important to report on next and how we can best tell the story.
Awesome. It's fantastic.
Thank you so much. Stop
so
sharing.
Yeah, you can stop screening. So what's interesting, I was just thinking that, many of our other presentations have looked at content of the media or how people use the media or messages in the media. And it's easy to forget that that is a product of a tremendous amount of human activity and interpretation and choice and options and constraints. So apart from the really interesting but also challenging issues of reporting on COVID, you're showing that, to create that apparently fixed message requires a huge amount of sense making and responding to the world and dealing with stuff. So we should all, as academics, we need to keep that in mind for sure. So I'm glad that you were not overtly threatened in any of these situations.
Yeah, during some of the protests, there were times when it got a little challenging. At one time I was filming on my phone, since that was sometimes safer than holding a big camera. Got knocked out of my hand one time by someone, things like that. But luckily nothing too crazy. So
maybe that's why it bothers you not a bit to go to places like, Miramar or Africa. So after all, you've been reporting in New York City. What can be more threatening?
Yeah, but they say, right, in that song, if you can make it there, you can make it anywhere. So I don't know.
Right. Fantastic. Thank you so much. Okay, I'm going to share my screen. I'm trying to, but it won't. I'm sorry. Why won't it? Slideshow. For some reason, I can only, I'm very sorry, but I can't seem to get it to actually show the whole screen. Something about my cursor. Anyway, okay, so I'll try and keep this a little short. We're a little behind on time. I want to first say that this is actually a first authored by Vard van Zunen, who's at the University of Amsterdam, soon to be a colleague of Frederick Hopp. He is also a postdoc at University of Jyväskylä in Finland, where I've been, which is why I know how to pronounce that word. And also Clartje Terhoeven, who is at Erasmus University Rotterdam. And both of these fine folks have visited Santa Barbara a number of times and have coordinated and collaborated with several of our faculty and graduate students. So it looks like it's spread around the world, but it's a very close network of folks. And the issue here is against sense making. And there's lots of indirect, you could say, effects of COVID. And one of them is, how does it change the nature of work and how does it change your identity? So, again, why can I not get this to, okay. Sorry. So general research questions is during, before and after, and then there's COVID, and your work is being disrupted in a lot of ways, but also there are other issues, which in this particular case, the very nature of your work is recategorized. So what effect does that have on your identity and on your well-being? And we saw with Robin's work and others that well-being is one of the outcomes of these kinds of studies. But also, how does it affect sort of intervening aspects? Um, and we'll see one of those is the quality of the organizational change communication. So we're also talking about messages the organization has to engage in to help manage this process. And we'll see in our next presentation from Jamie, organizations that specifically attend to that. So just briefly, some of you are already familiar with organizational sense making, which was made most popular by Carl Weick. And his argument is that organizations are interpretive systems, not just fixed entities where facts sort of flow. Rather, people have to reduce equivocality. They have to make sense of things. And they do this through a variety of ways. And he has a whole quite elaborate and very interesting sort of system-based, a lot of feedback, a lot of interaction between people. You decide on the proper approach, you take it, and then you see whether that works, and maybe you adjust it again. So violations of these cues to make sense can create problems for you, and they can actually affect your mental health. So of course, this is certainly relevant during COVID because it is highly ambiguous, highly uncertain, and highly risky, and still is in all these domains. So what are some cues? Well, one of the cues that is something that you need to make sense about was, as we'll see in the Netherlands, the government, the health department decided that some work was essential and some work was non-essential. Same thing true in the US. Essential workers can continue to work, they have to provide to society. But that means they have to engage in different behaviors. Maybe they get different kinds of resources, but also it changes their status. So for instance, let's say you have a bunch of people who are working and all of a sudden some of them are non-essential, so they don't go to work, maybe they don't get paid, maybe their kids can't go to school, but essential workers, because they have to work, their kids get to go to school and they get insurance and coverage. So that changes the status and your personal identity. So that can threaten your identity, but also can generate mental health effects. So it was a quite elaborate series of relationships going on there. So also just general work disruption from COVID-19, different procedures, schedules. I mean, Justine was just talking about trying to be a reporter, which is already extremely challenging and hectic. In these new conditions, everything she did was disrupted, and yet she still had to try and accomplish her goals. So what we've seen is these disruptions. We also saw in our little poll that some people felt all this hindered them at their work or their balance, but also some of them felt like, oh, it improved my relationship. So lots of varying effects. Well, those, again, going back to our nonprofit organizational study, there is communication that is done both internally to your employees, your staff members, and also externally to your stakeholders and to your publics. So we know from the organizational change literature that internal organizational communication is extremely important when you want to implement any kind of change. So here the question is, what's the role of change communication in helping people adjust to these disruptions and this recategorization? So if you have really good, supportive, and explanatory communication, that could help reduce identity threats. And it can also provide a consistent narrative so that you kind of know how to frame things. So two particularly sense-making interpretations then are threats to this organizational identity. Both the disruptions and also your reclassification creates a threat to your identity, which is really important. And Karen Myers, for instance, does a lot of work on organizational identity. And therefore it can create strong reactions, including effects on mental health, but also job burnout, turnover, errors, conflict, things like that. Another one is the meaningfulness of work. So we know from a rich history of work that yes, it's jobs you have to do to earn pay, but also the work that you do has different levels and kinds of meaningfulness. And you have to engage in meaning in your work to at least some extent. And if you're fortunate, you experience a lot of meaning in your work. I think most, all the people here involved in this conference and attendees, you know, what you do, you think is important and significant to yourself and to others. And so work creates this identity, but also a sense of power and meaning. So if there are different cues that are changing about how meaningful your work is, so for instance, all of a sudden you're told your work is not essential, don't you think that would affect how meaningful you think your work is? And then finally, there's all sorts of measures of mental health and well-being. We used standard measures of anxiety, distress, and depression. And therefore, we think that all these can be directly and indirectly affected by the things we've talked about: the recategorization of work, disruptions, change community, identity threat, and the meaningfulness of work. And here is, I want you to memorize this. You'll be tested later on your online survey. It's really nice working with Vard because he can deal with these levels of complexity with fantastic ease, and the rest of us try and follow along. But here is basically a structural model, just like we've seen in several other presentations. Here's the basic cues. Here's some intervening variables, which is threat and meaningfulness, and then it can have effects on different aspects of mental health. So that's the model. So this was conducted through a survey, and it specifically asked for people whose work had been recategorized into either essential or non-essential. So even though we don't have a time one data, we do have causality in terms of work categorization. And so there's kind of an even sample size of non-essential, and here's the types that were categorized as non-essential, and essential workers. So again, before this time, these people had not been categorized this way. So we measured, all the things in the model: change communication, disruption of work, schedules, routines. We knew whether they were essential or non-essential, and we also asked them information about that and corroborated that with their positions that have been defined by the government. We measured their threat to their identity, their organizational identity, their meaningfulness of work, and then 3 subscales of mental health. So these are all really good measures. A lot of them are standard in the literature, good reliability. So the measurement model fit, which meant they were all good measures. They were good loadings on the underlying measures, and they didn't covary too much with the other measures, so they were distinct and valid. And therefore, that allows you to actually test that full model to move ahead. And in both cases, the fit was very good. These are, detailed statistical things. So what can you see here? Well, some of the hypotheses was supported and some are not. And this is, the coefficients here are for the essential workers, and the coefficients here are for non-essential. And what you find is not really a huge amount of difference in some of the main relationships, but there are some where there's a relationship for depression that's not significant with respect to identity threat. But it is with respect to work as meaningfulness, and it's not significant for those who are essential workers, but here it's significant for both of them. So one of the issues here is if you are an essential worker, then whatever identity threat that you feel has no effect on depression, but it still affects your anxiety and distress. Whereas if you are categorized as non-essential, that in fact affects your depression. So people who've been categorized into non-essential work see that as a cue, they identify that, and for some of them, they actually experience worse states of mental health. Work as meaningful didn't actually affect anxiety, but it did affect distress and depression. So as a subnote, the nice thing about taking an important concept and looking at their subdimensions is the notion that these could play different roles. And so you can see that they're predicted in somewhat similar ways, but also somewhat dissimilar ways. So we can tease out some subtle differences as long as we have good concepts and good measures. So you can see that disruptions were associated with higher identity threat, especially for non-essential workers, right? And these things provide sense-making cues about the meaningfulness of work. Worse mental health if it triggers identity threats. That makes sense, but now we can actually see it. And one of the ways that identity threat is triggered is by being recategorized as non-essential. I mean, no one wants to be told, oh, as of today, you're no longer essential. That'd be pretty disturbing. So what are some limitations? Well, it does contribute to this literature on organizational sense making in the particular COVID-19 context and within organizations. And we can see that sense making itself is not an outcome, but going back to Weick's model, can also trigger other kinds of effects, and that will feed back into other kinds of sense making. So this also extends, there's a lot of interesting work on frontline employees, first responders, healthcare workers. There's not as much yet response analysis on, ordinary people who aren't on the front line. So this contributes to that. And the basic conclusion is that if you have been recategorized as non-essential, you're more likely to interpret these disruptions as your threat to your identity. Here are some other aspects, limitations, but also implications. So organizations need to communicate about shared and positive identity, particularly during these times of disruption. Of course, it's a limit in the sense that it's one country, it's cross-section, although we do have causal arguments because they have been categorized into these two different groups. Of course, there's many other influences. We don't know about long-term well-being effects. These were measured, at one time. We don't really have access to the organizational change communication. We ask the individuals to evaluate it, but we can compare these two kinds of workers. So it's kind of a breathless overview of this work, and I certainly thank Vard and Clarcher for allowing me to work on this with them. All right. And we're now back on time. So our final presentation is by Jamie, and I'm going to allow Jamie to share her screen and take us away.
Thank you, Ron. Let me just load it up.
There you go.
And
Perfect.
let me know, is it sharing okay?
Yeah.
Perfect. All right, I know I'm the last presenter of an awesome day of content, so I appreciate everyone sharing the last 20 minutes with me. I also acknowledge that I am not presenting live from Africa, which is very cool, and like my colleague Justine. The sun is still shining here in Sacramento, so I mean, I have that to offer. During our time today, I want to think about the fact that as employees, we spend 40 hours a week at work. We cannot expect to separate ourselves from what is happening in the world when we leave to go do our jobs. And many or most companies understand that, and they recognize that they are a significant component in a person's well-being. Also, Ron, as you shared, work is a powerful source of meaning for many, and organizations do play a role in the sense making. So during our time, I want to share some examples of how companies are communicating their care to their employees during the pandemic. Let's see if this is gonna behave today. Oh, good. So in the first case study, I want to look at Microsoft. And so by way of backing up for a quick introduction for context, I worked for Microsoft for the last 16 years and just recently left Microsoft, as Ron had said, to join Cruise about 6 months ago. So I was able to be in two different companies during a pandemic and provided some observations from both. So in this first study, I'm looking at the team conversations that we did at Microsoft. Microsoft recognized that in times of change and uncertainty, they feel a responsibility, which is beautiful about the company, to show care to their employees. And so the way that they tackled it very early on in the pandemic was to design a series of conversations to use as a forum for managers to facilitate and create a trusted space where employees could talk about how they were feeling, exchange best practices, and truly support one another. I'm using two monitors, so I'm going to have to kind of keep playing with that a little bit. For the team conversations, they really wanted to have, they wanted to remember that the managers who were facilitating those conversations were also themselves impacted by COVID. And so Microsoft wanted to ensure that they created strong framework and guidance for the managers to leverage so that they could have those conversations without having to kind of think through What's the best way to do this? What's the best way to engage? And also Microsoft is known for employing neuroscience principles and learnings when they're creating engagement and development content. So for them, they were able to build all of this work, and I'll show you some peaks of that in a moment, and really help support the manager in supporting the employee. They went as far as even providing tips for how to host virtual meetings and how to facilitate based on team size, because for some people, hosting a virtual meeting was something they'd never had to do in their career. The thing that they focused on, and really wanted the managers to do, was to be a model. They wanted to set the tone. They wanted to create this space of compassion and care. They wanted folks to be able to share their experiences. They wanted to make sure that they underscored it's okay not to be okay right now. It's okay to be uncertain. And they wanted their managers to act as active listeners. They coached us prior to these meetings to say, hey, don't be the first to respond. And also be paying attention to who isn't engaging in the conversation, not to call them out, not to make them uncomfortable, but rather just to note, are they doing okay? Should you check on them later in private? Or is this somebody that traditionally is more of a listen, marinate type, and it's okay that they're going to not participate in the conversation as much? A lot of thought went into the preparation behind it. One of the things that I really appreciated about what Microsoft did and how they went about it is this slide. And this is actually a sample slide from some of the content that they created. And that was being able to normalize and provide context for why people might, not always, might be feeling the way they were feeling. And again, they used some of their partnerships with the Neuro Leadership Institute and some of the neuroscience principles to say, okay, employees, like you're in one of those moments where our physical safety is being threatened and our brains are going back to caveman times and we're going to fight or we're going to flight. And it is understandable and to be expected that your cognitive abilities are diminished and that you may not feel like you're as productive at work and that you may feel like your responses to common workday things elicit more emotion than they normally do. And I think this was the first step, and this was a slide early in the kind of provided content that managers could use to really set the tone for how the conversation would go. Well, I'm not going to go in to explain this whole busy slide. I'd rather share it as an example of the content, again, that was provided. And this was really a way for managers to help employees strategize on self-care and well-being. So the focus, as I've already explained, was just about kind of holding space and taking care of each other rather than how do we get our productivity back up? How do we figure out what assignments aren't getting done because we're all just not quite at our best from a work perspective? And instead, they offered up things like, hey, we're all a little testy. Let's assume positive intent. We need to be really, really thoughtful about our self-care. And for many people, unlike me who already worked remotely, if you're working remotely for the first time, you may have trouble with boundaries, right? Because you don't get to physically leave the office and drive home and have that, very kind of physical demarcation between work and home. And also, you have to have new ways to even connect with each other. For many people, work is also part of their social network. And how do you now connect with people when we're all isolated in our own homes? And so I really appreciated some of the tips that they provided and some of the discussion that came from this slide. Microsoft has an interesting practice that they don't just use during the pandemic, and they have a practice called check-ins and check-outs. They use them in team meetings often, and it's basically a technique designed to make conversations more inclusive for teams. So during a check-in, the participants of any meeting would be invited to, but are in choice if they want to or not, share how they're feeling, either live or through chat, to 2 questions. And typically those questions are, what am I feeling in 1 or 2 words, and what might be distracting me. So I've gone into team meetings in the past and said, I'm feeling tired and I'm distracted because I'm hungry. It could be something that basic, or it could be something much more deep, like I'm feeling troubled by the news in the world. I'm feeling hopeless. You never knew. And the thought behind it was we didn't turn it into conversation, but as you're engaging in any sort of discussion in the room, whether it's a normal workday team meeting agenda or something else, you now have some context, maybe for people's body language, for how engaged they are or not. If they look, if I looked grumpy and now you know that I'm just hungry, that kind of gives you some understanding of where we're coming from when we walk into a room. And then the other practice then becomes during the checkout, then they're invited to share how they're feeling after a conversation. And that was really powerful in these well-being conversations to understand how the participants felt post these conversations. And so here are some direct quotes I either heard or read from one of the sessions that I facilitated. And so imagine talking through, it's okay not to be okay. Here's some things to do to take care of yourself. And these are some of the great things I heard. Feeling lighter, feeling like it's good to know how others are doing. They felt really good that Microsoft was focusing on these discussions, and they felt like they had some things that they could walk away with, some action items or some things they could try. When I look back on these meetings, I'm a huge fan of this approach. And so for me, I thought they did a beautiful job of demonstrating care and intention. They ultimately ended up creating an opportunity to use this kind of a framework in the future, and we did. Fast forward to George Floyd, other really tough conversations. I used a similar model to be able to have those conversations with my team in a safe and at this point predictable structure. The other thing that I'm sure was an unintended consequence, but was kind of interesting, is these conversations provided some new team vernacular, and that it created some humor and some bonding. So the picture here is just of a gentleman walking a dog, and that was because in one of the sessions I facilitated, they said, yeah, my only kind of break is when I go walk the dog, and my poor dog's been walked 4 or 5 times today. And so this became kind of a running joke in one of the teams that, off to walk the dog again. The only thing I would temper with it when I think about my impressions of it is we had to balance the time we spent in a really productive discussion like this and just people's general meeting fatigue. So even if something is something you care about, even if the conversation is engaging, that means you're in a meeting with your coworkers instead of with your family, your pets, your outside world. And so we were always trying to balance kind of how much time we brought people together versus giving them time back in their personal lives. The second one that I'm going to touch on, and a little bit lighter, just respecting the time as well, is looking now at my current company, Cruise, which Ron mentioned. We're having a lot of fun building the self-driving car. And one of the things that they looked at was kind of the benefits. And many companies have done this. And what they recognize is that this is a really, I don't have to say this, but unparalleled, unprecedented time. And even if you tell people, take vacation, take sick, there's tons of research that shows most people don't take full advantage of their paid time off in companies. And so Cruise implemented COVID rest days. And so they looked at the calendar and they said, for every month that we don't already have a holiday, whether it's President's Day, Memorial Day, etc., we're going to have a Friday that is a company-wide holiday. The thought behind that is if we shut the whole company down, people are less likely to work on that day. They're not having to feel torn between taking a day off and missing a meeting. Also did not take away from employees' sick time or vacation time, which was really helpful, so they could save their vacation, because many people had to postpone vacations for a time when they could do what they wanted to do again. And employees were really encouraged to spend that doing something joyful, to spend that time doing something that is restful. And they were also encouraged to share their time off on their social media channels. The other part of the COVID benefits for crews that changed was the sick time. They recognized that people were going to need to take time to care for sick family members, to get vaccines, to just deal with the side effects. There was a myriad of things. And so at Cruise, we actually gave our employees an additional 10 sick days for the year to have those available to us for any sort of COVID need, or frankly, any other eligible time off need. I think that was a powerful combination because now as an employee, you had both dedicated rest time as well as ample time to do things you had to do to take care of your physical health or that of your family. I took a quick peek at some of those social media posts about COVID rest days, and there was a ton of fun ones to pick from. And I picked two, and depending on the monitor you're using, these might be hard to read. So I'm just going to read two quotes that I really think encapsulate how the employees felt about it. One is, "Today is a company-wide COVID rest day at Cruise. I'm grateful to work somewhere that recognizes we perform our best when we take time to relax and recharge. Enjoying this long weekend in sunny Palm Springs." And then of course, hashtag life at Cruise. And then a second one that I also thought was really pointed was, "In the past year, have you just longed for things to stop for just one moment so you could process or catch your breath? If you're a parent, have you wished you could stop multitasking and be a full parent for just one weekday? Cruise as a company has decided they value this and has implemented COVID rest days, so I can do this on this Friday." And it shows a picture of Carrie Ann with her kids. And I think that you can see there where employees feel the care, they celebrate the care, and then they also share it with others. As I wrap up, the last thing that I really wanted to think about is, I mentioned delicate balance of meetings, but there's also delicate balance of how we look at anything we do, whether it's programs, meetings, whatever the case may be. I've led teams for a very long time, and you will always have some component of the team that doesn't feel helped by it, or may even feel that it's counterproductive. And so these are some things I actually heard either at Microsoft or at Cruise. When we think about those team conversations, it was, I'm really uncomfortable sharing my struggles with my team. So sitting in those discussions, while nice, just made me feel awkward. Thinking about the COVID rest day, to take the day off work, I'm just going to have to work longer the other 4 days. If I'm not going to get that day, then I'm going to pack it all in. And we hear that even about vacation. It's part of the research of why folks don't always use their vacation time. And then there was people who could acknowledge that things were helpful, but we also have to understand that this is only one thing and it may not help. And so somebody said, "I appreciate it, but I'm still really in a bad place." And so I think always being cognitive of the fact that companies like Cruise, like Microsoft, and like so many companies you can read about or are familiar with that are really trying to demonstrate care, communicate that care to their employees. It's not a foolproof solution. And we just have to continue to be thoughtful about offering a variety of ways to do it, a variety of forums for people to participate, and then understanding and being respectful when people either opt out or don't get the benefit we hoped they would. And with that, I'm going to turn it back over to you, Ron.
All right. Well, Jamie, you always do such great work. Jamie has done career day sessions and participated in other alumni council activities. And I'm just always impressed how thoughtful and caring you are. And so wouldn't we all love to have her? I mean, she's very high up in these organizations. We would all love to have her as our boss, for sure. And also, I think it's a nice compliment that just like Justine talking about how a reporter actually does their job, you're talking about some very, very specific things that organizations actually do, not things that are abstracted or conceptualized through measures that are standard in general, but things that they actually really do. So I think it's very inspiring. Gavin, do you have questions for any of us?
Yes, yeah, the first question that I have is for Justine. Just such a cool presentation. Thank you again for just talking about all the challenges that you face. One of the things that we're wondering about in this question is, early on in your presentation, you were talking about having to report on inconsistencies or having some points in which maybe data is being posted and that opinions might differ over how legitimate those numbers are. How did you handle reporting on inconsistencies without impacting your credibility as someone that works in the media?
Thank you. Thanks, Gavin, for that. It was a challenge, as I said, but what we tried to do was just give as much information and context as possible. So, for example, we would tell the viewers that there are different ways of calculating positivity rates, for example. So that's why the city might be this and the state might say that. But after a while, you can't explain that in every single news report that you do. So after a while, we would say, sometimes we would give kind of an average and we would say it's around this. Sometimes the rates were fairly close. Sometimes they were widely different. So on the days when they really were widely different, we would say they're widely different the way they're calculated. When they were a little closer together, we would just say it's around this. But yeah, I think the biggest thing in general, not just with that positivity rate, but any other time there were discrepancies, were just to be as transparent as possible, because the truth of the matter is that they really just were differences. And so instead of trying to kind of couch it and try to make it sort of look the same or something like that, it's always better to just be upfront and say, this is what it is and this is why, and just really just report the actual facts as they are and as they're given to us.
Yeah, yeah, I think in some ways that's similar to, situations that maybe I come across when I'm giving presentations or when someone asks me something that I don't know. And there's always that temptation to make yourself look good. But having that transparency is so important, most especially in media now. Justine,
Just
and oh,
Gavin,
sorry.
footnote. So, Justine, you've perfectly represented some of the results that Abel Gustafson found in his dissertation, which with climate change, that it's much, much better to be clear about your uncertainty rather than allow it to be interpreted as though it's either bias or ignorance. And the notion of error bars or reasons for it, actually, most people prefer that. They can deal with uncertainty. So you're just on the ground version of that research. If I want to intrude just a little bit. So how did your audiences respond to the media and their coverage of COVID-19, like in New York City? Just in general.
Widely differently. Some people would come up to us and say, thank you so much. You keep us informed. We turn you on every morning to watch, etc. Other people were like, you're making this so much worse than it is, and you're the ones causing the problem, and everything's your fault, So it really ran the gamut of responses. But I would say by and large, people would say, thank you for being out here and doing this and putting yourself in the position to be here. So overall, it was fine, but there definitely were people on both sides of the spectrum, as there always are, regardless of what you're reporting on. So it was an interesting to see people's responses.
Thanks. Back to you, Gavin.
Yeah, Jamie, we had a question. It sounds that some of the things that are being instituted at Cruise, like the COVID, extra COVID days off, seem like they're making a really positive impact in your working environment. I'm just wondering how you think similar strategies might change if they were implemented in different types of organizations, especially as we have a wide spectrum of certain organizations that are maybe a little bit more strapped for resources during this time. Is there something unique about the type of organization that Cruise is that has made some of these policies be more effective?
I think that one thing that I might point to, Gavin, would be industry, right? We can't, if you are in healthcare, we can't shut the hospital down for a day so that everybody can take a day off on the same day, but obviously so. So I think certainly, you know, companies that can basically tell everybody, including their customers, hey, we're taking a day off, have an advantage. And I think it's also fair to recognize that even though, you know, take a company like Microsoft, if you give them a day off, if one of our servers goes down, somebody still has to go fix it that day. So there's going to be extenuating circumstances to that. I do think that the most interesting probably would be is while these things are done intended for care of employees, there's also an expectation of technology companies and frankly, a little bit of the competition of their ecosystem. They have to be able to demonstrate care. They have to be able to offer kind of a proactive view to employee engagement and experience, because the people that we hire, and me leading recruiting teams, all of these folks have a choice where they work. And so are you going to work for the company that says it's a pandemic and our, you know, profit margins are down, so you must work harder? Or are you going to go to a company that says, listen, we know, you know, we saw some dips in Microsoft. We know that we had challenges getting parts at Cruise, but we still, despite that, are going to care for our employees. And so I do think there's a certain amount of competitive pressure, which is a good thing, to ensure that our employees get that care.
That's actually kind of, when you think about it, a tremendous transformation. And I don't know when that really took off, but the notion that caring more for your employees, including absorbing perhaps losses, temporary losses, is actually a competitive advantage. That does not fit into standard economic theory at all.
Well, and I look at some of the benefits I didn't talk about, but we gave people extra you know, money in their paychecks to buy work from home supplies. There was a myriad of things that I could have pointed to in terms of what companies are doing. And you're right, like these are things, and there's probably some thought behind why they ask us to share those on our social media. So
Yeah. Fantastic.
One last question I had was about your presentation, Ron, because when we think about essential workers having poor mental health consequences when they're deemed no longer essential or they're not actually able to work, it makes me think about the future, and it makes me think about how climate change is really making some types of careers not at all viable and creating needs, I think, for not only us to change our practices, but for people to reinvent their identities and to change the types of meanings that they get from their work. What is there anything prescriptive from your research that you think could lend itself to these careers that we're seeing rapidly die out?
Yeah, that is a central question. It's really a challenging one. I mean, throughout sort of economic history, the notion is when there's a transformation like industrialization or a new technique or a new process comes in, there'll be a loss of particular kind of jobs or de-skilling with automation. But then there's also the argument that all these things have also brought on more interesting kinds of jobs, managing the systems, being more analytical, although often there are fewer of them. And so there are job losses. A macroeconomist would say that these are painful transitions, and the people of that generation, of that cohort, are going to pay those costs. You know, and hopefully the industries will revive, or education will revive. Like, for instance, Musa is presenting, he can apply a level of computer and data analysis expertise that I've never, you know, I did something like that in my dissertation, but I didn't have access to that. So the more and more of that happens, the more and more I'm going to be de-skilled, really, frankly. So I think it depends really, really strongly on the social values. Now, of course, in these times, social values get sacrificed, right? And so Jamie's point is very, very hopeful and optimistic, is that no, but you realize, you know, you have to do these things in spite of the cost. And we saw in my other study that, you know, if you do different things, you can actually respond more innovatively to what our parents. So if you have a traditional kind of response, you're going to retrench and you're not going to innovate. So the same thing here, these organizations realize they have to do something different. Now, the question is to what extent these organizations feel responsibility to not just their employees, but their community. And that's a huge debate. I mean, large stores, big box stores, different companies that are outsourcing and going virtual, a lot of communities are really suffering from that. So there's no simple answer. I mean, you could say, well, it's the company's responsibility, but unless they get tax credits or something like that, it's not actually competitive unless they're in the fields that Jamie pointed out. So then it goes to the educational system. So you're going to offer better training for future jobs. Well, then you're also with climate change, people move. Immigration is going to probably be the biggest effect. And a lot of people are not even going to have jobs. So you have to think at a higher level. Okay, what kind of, for instance, nonprofit organizations or social service organizations should we invest in, given that during this transition process, a lot of people really aren't going to have a good option.
Mhm. And I think that those things are even more pressing. I look at the Biden administration, some of the promises that they're making and things that they're prioritizing, such as creating jobs that will help rebuild or strengthen the middle class, but specifically jobs that don't require college degrees. And so I think we're in a very interesting time where a lot of jobs are going to have to be completely transformed, but it's not quite sure whose responsibility it is to facilitate that change.
Well, that's the fundamental ideological conflict, right? What is the goal of government and society? And the notion that everybody is responsible for themselves just does not take into account most of what's going on in the world, which is we're all interdependent. And you have
Mhm.
to have higher level social institutions like the government or education or agencies or nonprofits fill in that gap. The marketplace is not going to fill that in because they aren't
Mhm.
rewarded for it. So you have two different administrations with two diametrically opposed responses. There you go, right? So what does
Yeah.
society want to do? It's not obvious. Well, we've come to the end of the day. It's been unbelievably informative and entertaining and such a great pleasure to see all these people and all this hard work and all these insights. And Gavin's done a fantastic job. He and I have gotten along very well in planning for this. We have still experienced a few bumps even during this session. No matter how much we've worked, we continue to find new bumps, but we made it through. I thank you all of the presenters who are here. I thank you to all the attendees who have stayed with us. And the videos will be available on the Rupe website maybe within a week or shorter. And again, for those of you who are students seeking extra credit, you will get that email link and you don't have to respond to it right away if you have something else like dinner or a nap, which are very high on my list right now. It's okay. So thank you all. Hope that you all do well, stay safe, help each other, um, pay attention to good information and not bad information, whatever that means. All right. Take care. And Justine, thank you so much for joining us so far away. And Jamie for taking time out of your hard work. And Musa for your great representation of your project. I'm sure Renee is going to be extremely pleased with what you did. And you can tell him I said so.